and welcome all. I'm Josh Stevens, Marketing Manager at Ansell, and you're joining the first episode of our podcast series revolving around maternity departments, where we're going to explore the challenges maternity faces to begin with. Joining me on this podcast is Cara McCarthy, a midwife by trade with 10 plus years in the NHS. So, Cara, welcome.
Thank you.
Tell me a little bit more about who you are.
I'm Cara, and I have been a registered midwife within the NHS setting for a number of years now. I've worked broadly across the department, so I've worked in all areas of high risk and low risk care. I've worked in community, I've worked in the hospital setting, I've worked in the obstetric unit, and I've worked in the midwife-led unit. And I've worked in a few different hospitals in various capacities across the years. So I would say I've got quite a broad knowledge.
Absolutely. I mean, so you have real years of experience working in maternity. What do you find the biggest challenges that's facing maternity at the moment?
I think over the years, I mean, even from when I started my training way back, even then there was a lot of talk about how things were changing, how things were getting busier at that time. And we're talking, over 10 years ago. And I think over the 10 years, when you look at society as a whole and, the way the world works, I think you can look at sort of the demographic of people, and you can see that care gets more and more complex as the years go by, as more and more things become accessible. So our demographic of people that are coming into maternity services has definitely changed over that time. We see a lot more older women. We see women from all different parts of the world who may not have had as robust antenatal preparation as maybe is on offer in a developed Western world. And alongside that, we also have a rapid decline in the number of midwives that are available to us.
So you talked a lot about the demographic has changed. We've seen a lot more older women are now getting pregnant at their age. The access to healthcare, is that something that is getting worse? Or because you talked about, obviously, people come from different countries, we have a lot more coming in.
Yeah.
Is it from the immigration where their access is less, or are we also seeing it locally in the UK that the access is sort of inequitable?
I think it's really broad because you have obviously a lot more movement of people around the world. I mean, I worked in a very busy London trust, and so the demographic was really, really broad. So you do have a lot more women that maybe come over, maybe marry here and then end up staying here, and they start off their journey in this maternity service that we have. So they kind of maybe have sort of different cultural backgrounds and things like that, but the way that they start their journey is the same. So it's not so much that, but I think that with availability of medical science as it is now, we do see a lot more older women. And then to make that even more complex, we already know that women from Black and minority ethnic backgrounds are at a higher risk medically anyway. And then when those women are also older and perhaps have a higher BMI, their risk factors just increase constantly. So you have a very complex care pathway on the whole, rather than the very low risk women that come through. So I think the complexity of care is double-edged. So you have the complex women, but you also have language barriers, and you have different beliefs and cultural beliefs that also come into play as well. So, all of these things that we embrace and we facilitate, it pushes the management of care to a more complex level, where in a very understaffed environment makes it a lot more difficult to manage. And so I think with that complexity of care and the lack of staff availability, it really does impact on the level of service that people get.
Yeah. So, I mean, and you said it earlier that there's been a rapid decline in midwives and sort of the lack of staff shortage. That's something that healthcare globally, but particularly we know in Europe, they're having a real challenge getting staff. There's a lot of frustration, there's a lot of strikes. So we're seeing it happen across, particularly hospital staff in particular. How is this impacting midwifery? Like, is it that they're not just getting, it's just numbers of people that don't have enough, or is it the skill set?
I think over recent years, there has been a rapid decline in midwife availability for a number of reasons. The pension scheme changed, so a lot of midwives took their pension early. You have aspiring midwives who maybe don't have the means to be able to do their training due to the fact that initially they took the bursary away, so that was a means-tested way of funding student midwives. They introduced university fees, so that makes it less accessible for a lot of people. So I think that now you've got an older generation of midwives who are retiring and a lack of accessibility for younger midwives to come in to do their training. And it kind of eliminates, or it really does make it very difficult for women who, I mean, I was in my 30s when I did my training. It makes it more difficult for that cohort of women or, people who are wanting to be midwives who aren't able to do a full-time university degree alongside placements in hospital doing shift work when they've got childcare to think of and, a home life and a family to look after. And it really does ostracise those aspiring midwives to be able to access coming into midwifery. So it's kind of both ends of the spectrum, the younger midwives coming in and the older ones retiring.
So we know that funding and resourcing, obviously with staff resourcing, but also resourcing with the capital and the money to support, isn't what it needs to be. We know the NHS is in strife, but certainly many healthcare systems. I know in Germany there's a lot of challenges where a few hospitals are folding. How could that change? Like, what, in terms of sort of better resourcing to support or better funding, where does that need to be funneled into? Like, what needs to change to support that they get the right staff in, but also can give the right sort of level of care?
Well, the NHS as a whole has been underfunded for many, many, many years. And so year on year with that lack of funding, it's always playing a catch up. And so it needs a big, big cash injection in order to get services where they should be, let alone then ploughing money into training and funding of, new staff. And it's such a big question that I don't even know that I have the answer, but making it more accessible for people to be able to go and do their nursing and midwifery training would be a start. And then you've got the wages on top of that, which, for the challenges that you face and for the skills that you need to have and for the stresses that you come into contact with every day, it's definitely underpaid.
So I think many people think healthcare in general is underpaid, but there's also been recent reports sort of produced by the Care Quality Commission, and they were showing in maternity in particular that there's been a decline in the positive maternity experience. So is that related? What's led to this change? Because we're expecting things to be improving, and yet we're seeing this go down.
I think COVID has a big, big part to play in that recent report. We talk about life in a before COVID and an after COVID kind of way now, don't we? It's very defining. And prior to 2020, we had availability of antenatal education, services were that we could freely offer home birth service, and the higher risk women and people could have access to obstetric units. And then COVID came along and changed the world, and then restrictions were put into place. And I think from 2020 onwards, we're still not back to where we were in 2019 in terms of some of the restrictions that are still in place or the services that are offered, particularly when it comes to things like home birth. We don't have the staffing available to provide that service, and that takes away choice from people who want to manage their own birth environment. And that has a big part to play in satisfaction and that kind of negativity that has come about. And I think during that time there was a lot of trauma that came about from women birthing alone or being told bad news alone or having poor outcomes and then their partners having to leave them straight away. So all of this has had a massive effect on the mental health of the women and people that are accessing our maternity services.
I mean, it's a pretty heavy topic because something goes wrong in maternity, it's death of an unborn baby or a newly born baby, or potentially even the mother themselves. It's emotional, it's traumatic.
Yeah, and we don't have the facilities to be able to cope with the aftermath of it. So, we do mental health checks in our postnatal care, and we're so restricted on time that mental health check in a postnatal check might just be, how are you feeling? Well, I'm feeling XYZ. Okay, well, so if you speak to your health visitor, so we're not as robust and thorough as we potentially could be. And that's a big, big downfall. And I don't think there's the training of midwives in order to facilitate when somebody is struggling, what services they can access. And on top of that, there's also the lack of services to offer as well. So it's like a big snowball effect.
Yeah. So get into healthcare, you care about the patient, you care about the patient outcomes. But a big part of how the whole system works is there's a lot of processes you need to follow, a lot of administrative, a lot of like bureaucratic processes.
Yeah.
How did you find some of these, which we know a lot of it needs to exist to help feed the engine, but how did that impact on you being able to deliver the best patient care?
I find a lot of services quite fragmented, and the referral system is not foolproof. So you do find that you find that a referral gets missed or people slip through the net somehow, and that's a big problem. And I'm not sure what the answer to that is, but that is definitely a problem. And I think that where services are fragmented, where you have to refer to a different department, and that department might have different policies and pathways in place of how they process things, and so it's not a seamless pathway of care. We call it multidisciplinary because there's so many different people involved, but it needs to be joined up more succinctly somehow.
So really interesting you just mentioned how it's multidisciplinary and syncing up, because I'll list there's three main areas that came out of one of these reports that required the improvement. And there was the availability of staff, there was the confidence and trust, but there was also the communications and interactions with staff. So these seem to be some of the three key areas that have deteriorated. And you're kind of touching on them then, the communications and interactions with staff. What is it, the COVID related, why it's sort of gone worse, or maybe that's increased it? And is that something that we can change? Is that going to improve in the future?
It possibly has had an impact. And again, with other departments, they are more than likely as impacted with their staffing levels. They are more than likely impacted with budgeting and financing issues. And I don't know what the answer is, but there needs to be some kind of system in place where we are able to refer quickly and to be able to follow that trail all the way through to make sure that the thing that we're referring for is actually being addressed. Because a lot of the time I could do a referral for somebody and then I would never know anything again. So we don't get that feedback to know whether this has been resolved, whether they've gone down the right pathway, whether they're getting treatment. We don't have that collaborative kind of input into that one person's care.
Is that something the digitisation of healthcare could help support, or?
Quite possibly. I've often wondered why we don't have a universal NHS notes system, for instance. I think it was trialled and I think it just came down to money, but there should be, for each person who carries an NHS number, they should have a digital card or whatever it is in order for everybody to be able to, well, everybody within the healthcare to be able to access that person's notes and see what the outcome of each thing is and to be able to see the report so that it links up nationwide, whether you are in London or Scotland, it should be accessible so that no matter where you are, you can simply hand over your notes and that person knows exactly what they need to do. But that doesn't happen. So things get lost along the way. If somebody's visiting a family somewhere and they're going for an antenatal checkup and they don't have their notes with them, well, then that trust has no record of what's been done in that pregnancy. Likewise, when they've given birth, if they happened to be somewhere and give birth elsewhere, they haven't got a record of that antenatal care. So it doesn't link up in a very effective way.
Wouldn't that go a long way to solving some of the cost challenges that healthcare is facing? Because
you would think
then you would move to going, well, we're going to treat things a little bit more proactively because you have full visibility on what's happening rather than being reactive when something's already happening.
Yes, exactly. And I think that, again, is probably something to do with finance gods within healthcare. But to me, that makes perfect sense because you're not then going to be repeating previous tests or investigations, and so therefore saving money in that way. You're also then able to give them prompt treatment for whatever it is, thereby, reducing harm. To me, that just makes perfect logical sense.
I mean, it's probably touching into a whole system reform, but we can dream, can't we?
Exactly.
So it does sound, though, when you were talking about it and you're only getting to see like a small snapshot of what's happening with the patient, this all adds to the stress that somebody working in maternity faces because it's I guess not high value, but it's as a department what you're working with and sort of bringing in, kind of multiplying. I've got one patient life I'm looking after to sort of two patient lives. Yeah. It's quite stressful already.
Yeah.
Plus you're adding all this extra bit. How have you found, for sort of yourself and other people, your colleagues that worked in there, that the stress levels with this environment that's been created and then new things kept being added to the plate, there's staff shortages, is that impacting how the quality of care can be delivered? Or is there just an expectation, here's extra plates, start spinning them?
That expectation is definitely there. But I do believe, we talk about the patient aspect of dissatisfaction and impact from maternity care that is received. But on the flip side of that, there is definitely a mental health crisis within midwives themselves because there is, like you say, that pressure and stress of, looking after two patients essentially throughout their care. And so you've got the pressure of the clinical aspect as well as the administrative side. And they do go hand in hand because you literally have to document everything down, A, because you've done it, and B, because, and I think everybody does kind of work in a little bit of a defensive practice because you need to be able to document and justify why you've done everything that you've done so that should a poor outcome occur of any kind, you can justify the action that you've taken and prove almost that you have done everything to the best of your care. And that stress in that environment is insurmountable.
It sounds like heavy workload to me.
Very.
little old me sitting here going, So, I mean, you covered a lot of challenges maternity is facing. There's the staff shortages, there's the funding and the resources, or the shortage of that.
Yeah.
There's that increasing birth complexity, what the quality of care that can be delivered, the inequality of access to healthcare.
Yes.
There's also that administrative and sort of bureaucratic pressures.
Yes.
I mean, a lot of challenges.
Yeah.
Maybe finish up. Is there something positive you see in the future of maternity where you go, okay, a lot of challenges, a lot of things to fix, but there's something you're going, that this is working?
Yeah, I absolutely love midwifery. It's not something you go into just because you decided one day, I'm just going to go and look after new babies. It's something that's in the core of you. It's something that, it's a passion to get there. And the training itself is the hardest thing in the world. But I think we are extremely lucky here and across Europe mostly, that we have this accessibility to most of the time state of the art treatment, highly qualified, highly knowledgeable healthcare staff. And it's all free for us at the point of care, and that's quite special.
I mean, completely agree. And I think what a way to sort of finish this chapter on is there's a lot of challenges ahead, but there's still a lot going right, and we're still very fortunate to have access
Absolutely.
to this public healthcare. Thanks so much, Cara.
Thank you.